Now, when it comes to head injuries and concussion, vestibular therapies are at the forefront. You really have to understand how the vestibular system works when you're dealing with traumatic brain injury patients, concussion patients, because a lot of people either will benefit from those types of therapies or potentially have problems with those systems that need to be corrected. So when you're thinking about vestibular rehab, one of the most common things that people think of is BPPV. Sadly, BPPV is not the be all end all when it comes to vestibular rehabilitation. So it is true that a lot of vestibular conditions are caused by BPPV. Now, it's really, you have to be trained enough to understand the differences from when something is caused by those little crystals in your inner ear or when something is caused by maybe a more centralized mechanism in your head. So doing little tests like Helmagi head thrust tests or maybe the Dick Hallpike test or maybe just looking at centralized gaze structures in the darkness. So all of these little different types of tests can kind of dictate and look at the different aspects of your vestibular system, and that can really help guide the therapeutic approaches to help in that vestibular rehabilitation of the patient.